This Walsh walkthrough is titled Understanding and Searching for Evidence-Based Practice. In part 2 of this module, we are going to discuss a PICO or PICO question. What is it, and walk through how to create one to begin your search query for academic research. This research module is presented in 4 parts as an overview discussing evidence-based practice, forming and using a PICO-style research question, an introduction and brief overview of research through Walsh's library and database resources, and finishing up with pointers for APA-style writing and reporting. For other videos in the series, check out our Walsh University Library YouTube page or skip to the end of this video for the next part, Research Fundamentals. Framing a research question can take shape in many ways. Since we are focused on evidence-based practice, I'm assuming we're going to investigate a topic of interest related to the effective treatment of a client or patient in a medical setting. This type of approach is seeking specific knowledge to inform clinical decision-making on a course of action. Mapping out your problem, intervention, comparison, and outcomes is a PICO cake. Sorry, bad pun. Starting by describing the type of client or patient or problem you're wanting to investigate is the P. Is the patient with a certain disease or condition? Is there a risk factor of general health or wellness? What are you trying to describe as the type of person or client you're going to be helping? The more specific or more terms that you can add related to this portion of your question is going to be important for searching later on. The intervention requires you to have some background information in your subject area. If you don't know a course of action that you would be taking with your client population, you're going to need to get some assistance either through scoping literature or asking your instructor or some other expert as to what would be the confines or the construction of what would you be doing for this type of client. A comparison is part of your investigation, but usually it happens or takes shape after you've been looking at other literature and you start seeing that there are different interventions for whatever the client type or problem or situation that you're dealing with. So often you'll construct a comparison, if necessary, based on some of these other interventions. And the higher levels in research that you are writing to, there will be comparisons across different levels of success that you may want to be informing your population about. The outcome is an optional measure of your investigation. And good research should always start with wanting to measure or state what the outcome that you plan to have for your client base. Having an idea of how you're going to measure success is good to have. And within a valid trial or treatment study, those resources should give details on benchmarks or outcomes that you can adapt to your own reporting. Basically, look for good measurable outcomes and work towards framing your question for the best available. A way of approaching a PICO question is to try and have yourself be informed for better focus. That will mean making sure that you have an understanding of your patient population problem, your intervention, your outcomes, what it is that you're really wanting to ask. So you're going to need to do some background reading. You may have to ask questions of your instructor. You want to be thoughtful of your own interests and ask yourself, what would you like to get out of this? Often I find that poorly focused questions are ones that will arise from clinical practice. Somebody has a question, and sometimes these questions occur to us just in an unfocused manner or an incomplete manner. Questions like, is adaptive equipment good for older adults? Can safe parenting classes help? Does hand therapy assist in activities of daily living? What helps in handwriting? So really, all those questions are just missing parts. And if you can put the question into context, answering all the parts of that PICO-style question focuses your intentions and informs you towards gathering evidence for that question prior to actually seeking out research. The solution to the problem is often to just rephrase the question in a focused format following PICO. The structured format of PICO promotes a more reliably efficient and effective search for evidence, and that will help you answer your question. Failing to focus your question can waste your time and frustrate you. Even if you have an information specialist like a medical librarian helping you with your search, you will get better results if you first state your question in a focused PICO style. Identifying each element with words, phrases, or ideas related to what you are interested in will form the strategies you will take with you into the academic research query in our next video. On screen is an example of mapping out the keywords and phrases of each element of a PICO question to help you get started in research. The question framed above would be something like this. Are traditional or multifactorial fall prevention programs more effective in decreasing fall risk and avoiding hospitalization in seniors with a history of falling? Each element of this question has terms you can use to frame your population, your intervention, your outcomes, helping you shape your research before you even dig into the literature. Finding how to describe your problem or patient, your intervention, or outcomes takes some prior knowledge of your profession. In the next video, you'll see how just having some basic concepts in place for a PICO question will help you shape an effective search strategy and find new information related to your query. After you've developed a robust search query, you'll be ready to dig through the literature that you have returned, select an appropriate high-level resource or resources, and construct your paper or project.